Hi guys, Dr. John and Andrea with Pro Chiropractic, and Andrea is one of our office managers here at Pro Chiropractic, and we are going to be doing a series on pregnancy adjustments. Andrea is 10 weeks along. I know you can't tell it right now, but she's 10 weeks expecting with her first child, and so I wanted to do a series of videos showing what the adjustment looks like and the kind of tools and approaches that we use. So Andrea was kind enough to agree to that, and she said, yeah, I'd love an adjustment. So first I'm going to show you the type of table that we'd use. Now at 10 weeks, we don't need really any special tables or approaches, and you're going to see that, but this kind of table does come up and make room with the pelvic breakaway and abdominal piece. So utilized together, and especially with the towel to make it more comfortable, we can certainly make room for as baby grows, but those lock away, and so we're just going to have you lay face down. This table also is a high-low table, so it raises up and down. So as baby grows and we have more pregnancy tummy, we might use some of those things, but we're just going to run through a nice full spine maintenance adjustment. Andrea, you having any acute issues right now?
No.
Okay. So I'm using a combination of static and motion palpation to assess and see where she might have some restrictions. Using a leg check as well. And now I'm going to do a little bit of Webster technique. I'm going to put some pressure into each side and see where we have. So we have slightly better motion on this side and this side. And this tells me a bit about her pelvic alignment. So we're going to look for restrictions on this left side, both back and front. So we're going to start with adjustment in through her thoracic spine first. Take a nice breath for me. And important for those watching and for Andrea especially to know is all of the adjustments that we're doing today. Take a big breath and tilt your head back just a little. Are safe for her and for baby. No doubt about that at all. Okay, I'm going to have you roll on your side facing towards me. Now at this point, we can use what's called a side posture adjustment. Some people joke that this sort of looks like a pretzel. But what we're doing here is getting her in a position where I can control her leg and her torso. And when I do that, I give the right amount of tension through her low back spine. So we're going to move her sacrum, take a big breath in, and out. Good. And I'm happy to roll the other way. Now obviously, as we get into later trimesters of pregnancy, we're probably not going to use this just because it'll be uncomfortable and maybe a little much pressure for baby. But at this point, perfect, straight to your back. No problems at all. Now I'm just motioning through, opening and closing the joints in her neck, seeing where we have good motion and where we have areas of restriction. I can feel a restriction here. Andrea, can you feel that as well?
Yes.
And so we're going to get that moving, reach. Okay, we had found some little bit of tension in, I'm going to straighten both legs here, Andrea, into her pelvis when we had checked the way her knees bent the other way. So we're going to do a little release into the round ligament of her uterus. Can you feel the difference in that tension there? Okay, so what we're feeling is springing just below this pokey point on the bone here, kind of diagonal towards her pelvis. And there's certainly more tension on this side, so I'm just going to put an upward and inward pressure here to try to relax the pelvic musculature. Obviously, a balanced and mobile pelvis can accommodate baby better and make pregnancy more comfortable for Andrea. is a tender spot in here. She's doing really good. Good, now I'll have you roll back on your stomach for one more check. So then as we post-check, looking at a leg check again, seeing the mobility we have. There we go. Feel the difference there?
Yes.
Good. And so that's a quick example of a full spine, proactive maintenance adjustment on our lovely patient, Andrea, who is 10 weeks pregnant. We're going to be progressing through and checking along a couple videos, so be sure to tune in and check for Andrea's progression as we go. Again, this is Dr. Jon with Pro Chiropractic. Be sure to check us out at prochiromt.com. Thanks for watching.